So Dr. Pitts, you presented on my favorite topic today, which is communication. As your professional yapper at Summit, I thought I have to do this conversation with you today.
Yeah.
So tell us about effective communication.
Well, hopefully I communicate effectively. Hopefully I did that in there.
You did. You're amazing. You're a great communicator.
I think that medicine is a unreachable topic for some people, specifically for patients, but even as professionals in the community as well, I think we still struggle because we have our knowledges. As we approach different people in different aspects of the field, there's fear that, I don't want to appear like I don't know as much as them, when realistically, like we've done in a previous conversation, I think it was John and his brother Gary both talked, and they're like, wow, we both know so much, but none of the same thing is so very, very different. And I think that there's so many of these different barriers that are similar to that really affect our ability to communicate effectively about patients and also about, what we do and our interactions with each other. So I think communication is the most undervalued aspect, I think, in medicine. And frequently I get the question, well, why did you go into medicine? And one of the reasons actually is because I love communicating with patients. I love the education process where you're talking about their condition and then that light just goes off and they go, oh, like I learned that in undergrad when I was teaching, and they would just get that aha moment of understanding the anatomy that we were teaching. And that's what I love. And so I think communication for me is dear to the
close
heart.
To the heart.
Yeah.
I love that. Well, communication is close to my heart too. I wanted to go into medicine so badly. I wanted to be an anesthesiologist, but I hate needles and I'm terrible at math and science. So that was a big no for me. But what I realized is I love communication. And even with, sometimes it's embarrassing truly, because I have a whole degree in communication. I studied communication. Communication every day is my job. And still I have communication faux pas, right? I still mess up in my communication. Sometimes things go awry, and it's interesting to take a step back and think, okay, I'm learning from this communication error. And so often people ask, well, how do I get better at communication? And I find that we're constantly communicating. Every moment is a lesson, right? Every time I communicate with somebody, I can step back and think, okay, how can I learn better communication from this person that I'm talking with? Every communication that I have, every conversation is an opportunity for a little bit better learning of communication. So what are some of the barriers that we come across, especially in medicine, when it comes to communication?
I think the first one, oddly enough, actually is humility. I think the ability to step back and go after every, like what you said, after every communication, stepping back and say, how did I do? Can I improve? That's a humble standpoint. Think of the opposite of the person high up on their pedestal going, man, you're just lucky that you communicated with me today. Do you know what I mean?
Right.
Like it's the ability, I think, to step back and go, did I do well in that communication?
Absolutely.
And then being able to grade yourself, not literally, but walking out and going, I think I could have done a better job, and recognizing that. I think that's step one.
Totally.
is understanding that we do have limitations and being able to be willing to change them.
Yeah.
I think the second thing, and someone said it very, very well there, is doing it in a closed loop style. I think that's a lot of time one of the barriers is we spew information and go, great, you caught that in a bowl, right?
Right.
When realistically, we need to see how much they caught, what it is that we said. And so the ability to close it. One of my favorite things to do at the end of a discussion with a patient is to summarize, but then say, what do you understand about the topic that we just talked about? Like,
I love
specifically with patients. I do this also with nurses. Like, okay, so what are we doing for Mrs. Johnson? Great, perfect. All right, I did a good job. Or, okay, I'm a little bit off, and being able to grade it that way. And then same thing with patients, making sure they understand their situation. I think one of the other barriers, I think, is knowledge mismatches. And that's not like knowledge mismatch like, oh, we're too smart for this person, but sometimes the opposite. And being willing to say, look, I don't fully know this topic, so can you explain that more? Can we talk about it? So whichever area of that knowledge gap you're on, either you know too much or know too little, being willing to recognize that gap is there and making sure that we bridge it on
Totally.
both sides.
Oh, I love that.
Yeah, I think it's a lot of time it's the opposite when we're on that higher end of that knowledge gap that we don't think about that. And I think that's where
Right.
humility comes in.
And in interpersonal communication at its finest, right?
Mm-hmm.
That everyone communicates differently, and your communication style is not better. It is different.
Yep.
And you are only better if you can communicate in someone else's communication
Yep.
style. You touched on this point, I think, really beautifully, and I think we've heard it a million times, but listening. Communication truly isn't about saying the best thing or talking the most. It's about being the person that can listen the best. So are we in a conversation, are we talking to somebody to listen and understand? Are we talking to somebody to answer back? Right? Are we just trying to get through their sentences so that we can have an answer? And likely, if that's the case, it's a predetermined answer, and we're not actually listening to their X, Y, and Z. And that could totally change the entire outcome. So really being an effective communicator to me is being aware enough in a conversation to pause and listen and not be thinking of your answer, but be thinking about the words that they're telling you.
And they showed in med school, they talked about this, that in general, it usually takes about 15 seconds for the provider to interrupt the patient after you come in. Say, great, I'm Dr. Pitts. You're here for your knee pain. What's your problem? The average interruption is within 15 seconds.
Wow.
And so that really was drilled into me in med school. And whether I know there's sometimes I don't listen to that, unfortunately. Again, I'm trying to grade myself here, but the most of the time when we can step back and just let them talk, it's almost more interesting because they reveal the puzzle that we're trying to figure out just by how they're saying it, where their emphasis is. You know, it's like, oh, they start talking about their cat, and it's like, what does this have to do? It has everything to do with them if we are truly listening about what matters to them, especially as patients. As my job as a surgeon is to find this physical ailment and make them better, but I need to make them better, not just that ailment better. And sometimes we're kind of considered technicians when it comes to surgeries. We're just isolated on that focus. But as we listen to them and say, hey, the cat to this lady is everything. So how can we make her life better so she can enjoy that? You know what I mean?
Totally. And maybe you do know the answer already, but again, we've heard it a million times. People will always remember how you made them feel.
Yep.
And communication is a lot of feeling, unfortunately or fortunately. And it's our job as a communicator to make people feel heard and safe and like we have true compassion for them.
Yep.
And I know that people are smart. They feel that when you're talking and listening to them. So it's this fine balance between, making sure that we're on time, getting them the information they need, but also having that compassion and communication.
Yep.
Well, Dr. Pitts, thank you so much for an incredible lesson on communication today. It's one that I could talk about for hours and hours. So let's do it again sometime.
Yeah. Thanks.
Thanks.